Do you know the 5 most common mistakes that patients undergoing a BBL, a Brazilian buttock lift surgery, make? Please watch this video right till the end, and possibly for you, the 5th point may actually be the most important. And don't forget to subscribe to this video. The first thing is the technique. All BBL procedures should only be done using the 𝗬𝗂𝗃 technology. Conventional liposuction is not the best to do a BBL. If you want the best results with your BBL, always choose 𝗬𝗂𝗃. The 𝗬𝗂𝗃 fat is broken down, very small particles, and they have a better chance of survival and creating a far better look. Therefore, we do recommend that you should only do 𝗬𝗂𝗃 for a BBL. The second thing is not choosing the right surgeon. I feel the experience of the doctor is most essential in getting the best results. So please have a look at the before afters, Instagram, Google, reviews of other patients, and that will ensure that you get a better result. 3. Over relying on technology. Now, there are always new things coming into the market for doing basic procedures. Now, BBL is a very simple, it's a very basic procedure in expert hands. And just by addition of technologies which push up the cost does not create a better result. For example, in the use, so I've heard of various new technologies which are being used to expand the buttocks, etc. I don't think they work at all. The reason being, it is scientifically proven that you need to fill the fat into the buttock in fine layers like threads and not in big spaces. Because when you create a bigger space, you're causing more injury. The fat is not coming in contact exactly with the tissues and receiving the blood supply. And that buttock area is still the same. If you expand it and then you create a new column on the side of it, the walls between the two are still the same. So I really don't understand how that is going to increase the efficiency of the result. Because we've been able to achieve amazing results just by use of fine cannulas, fine instruments, which leave fat like a thread. And it has been well proven that they are more effective in creating a better result. 4. Overfilling. What happens is, earlier people used to do 1500 ml, 2000 ml in each buttock. That doesn't work anymore. Because it has been proven, half the fat will get absorbed. So if you go beyond a certain limit, if you do more, you will actually get less. And then it is dangerous. Doing large amounts of fat, say over a liter of fat in a buttock, can be very dangerous. It can be really dangerous. So don't do that. Whatever the technology, whatever the technique, you don't want to take a risk. Would you want to take a risk? Last, when patients see pictures on Instagram or elsewhere on YouTube, and they see those fabulous bodies, they don't know that the patient has already had that procedure twice or thrice. What they assume is that this has been done once, which is actually not correct, because many of these models and actresses actually do procedures multiple times to get that perfect result. Therefore, you need to be very clear, you need to discuss with your doctor that in order to get that perfect a shape, you may have to do the procedure twice or maybe even thrice. So keep that in your perspective. I'm sure I added some bit of information to your existing knowledge, and you get more confidence to do things more correctly and not just get blown away by new technology, which probably doesn't work. I'm Dr. Amit, and we've been doing such procedures for the last 14 years, and we just do it